Every year, as the calendar turns to March 16th, a significant date is quietly but powerfully marked across India. This day is not just another page in the year. It is a symbol of hope, resilience, and collective action. It is National Vaccination Day, a day that holds deep meaning for millions of families and communities across the nation. On this day, India comes together to observe National Vaccination Day, a nationwide event that celebrates the country's commitment to protecting its people from deadly diseases. The tricolor flag waves proudly, and communities from bustling cities to remote villages unite in a shared purpose. National Vaccination Day marks a pivotal moment in the history of public health in India. It is a reminder of the extraordinary journey that began decades ago when the country set out to defeat one of the world's most feared diseases, polio. The origins of this day trace back to 1995, when the government of India launched the Pulse Polio Immunization program. For the first time, oral polio vaccine drops were administered on a massive scale, reaching children in every corner of the country. It was a historic moment, filled with hope and determination. The mission was clear and urgent, to reach every child under the age of 5 with life-saving vaccine drops. No child was to be left behind, regardless of where they lived or the challenges they faced. The campaign became a beacon of hope for families who had long feared the devastating effects of polio. But this was more than just a medical campaign. It was a national movement. Government officials, healthcare workers, volunteers, and ordinary citizens all joined hands. Their shared goal was to protect the next generation and build a healthier, stronger India. The relentless rounds of vaccination drives built a wall of immunity, one child at a time. Health workers went door to door, marking houses and ensuring that no one was missed. The program's determination aimed to eradicate polio entirely from the country. The journey was not easy. Health workers braved difficult terrains, crossing rivers, climbing hills, and walking miles to reach remote villages. They faced skepticism and fear, but their dedication and compassion never faltered. Their courage inspired trust and brought hope to even the most isolated communities. National Vaccination Day honors this extraordinary effort. It is a tribute to the countless health workers, volunteers, and families who made sacrifices and worked tirelessly to protect children. It also renews India's promise to remain vigilant and committed to a polio-free future. Today, National Vaccination Day stands as a powerful reminder of what can be achieved when a nation comes together for a common cause. It is a celebration of the first step in a journey that changed millions of lives and a call to continue the fight for health and safety for every child in India. The journey to eradicate polio from India began in 1995 when the country launched its first nationwide vaccination campaign. At that time, polio was a devastating disease, crippling thousands of children every year and leaving families in despair. The challenge was immense, with the vast population spread across remote villages, bustling cities, and hard-to-reach communities. The path to a polio-free India was long, demanding, and required unwavering commitment from millions of people. Vaccination camps sprang up in every corner of the country. From the Himalayan foothills to the southern coasts, families would wait patiently in long lines, sometimes traveling miles to ensure their children received the life-saving drops. Health workers and volunteers became the backbone of the campaign, going door to door, often braving harsh weather, floods, and even resistance from communities. Their dedication ensured that no child was left behind, and every household was reached, no matter how remote or isolated. The campaign evolved over time, adopting advanced surveillance systems and rapid response teams to quickly identify and contain outbreaks. Data collection and real-time monitoring became crucial tools, allowing health officials to track progress and respond to new cases with speed and precision. Collaboration was key. Organizations like WHO, UNICEF, and Rotary International joined forces with the Indian government, pooling resources, expertise, and manpower. Together, they overcame logistical challenges, navigated difficult terrains, and built trust within communities through education and outreach. In January 2011, India reported its last wild polio case, a historic milestone. But the fight was not over. For 3 more years, health workers remained vigilant, conducting intensive surveillance and immunization drives to ensure the virus did not return. On March 27, 2014, India was officially declared polio-free. The announcement was met with nationwide celebrations as people from all walks of life rejoiced in this extraordinary achievement. It was a moment of immense national pride and hope for the future. This achievement proved that with determination, unity, and collaboration, even the most daunting public health challenges can be conquered. It inspired a new sense of possibility and showed the world what can be accomplished when communities and nations work together. The eradication of polio became a defining chapter in India's history, transforming the lives of millions and ensuring that future generations could grow up free from the threat of this crippling disease. The legacy of this campaign set a powerful precedent for future health initiatives, proving that with collective effort, India can overcome any challenge and build a healthier, brighter future for all. As polio faded, National Vaccination Day evolved into a platform for universal immunization. The day now raises awareness about all vaccine-preventable diseases, urging parents to protect their children. It's also a time to honor frontline healthcare workers, the backbone of India's immunization efforts. Their dedication, often in the toughest conditions, safeguards millions. National Vaccination Day combats vaccine myths, building trust through education and open dialogue. It reminds us that vaccination is a collective responsibility, not just a personal choice. The day celebrates India's progress in public health and its commitment to a healthier future. It keeps the spirit of the Pulse Polio mission alive for new generations. As India celebrated its public health victories, the COVID-19 pandemic struck, testing the nation's resilience. Suddenly, vaccination became the world's most urgent hope, not just for children, but for all. India joined the global race to develop and deliver a COVID-19 vaccine, drawing on lessons from the Pulse Polio campaign. National Vaccination Day took on new significance, symbolizing hope and unity in the fight against the virus. The pandemic exposed vulnerabilities, but also sparked innovation and rapid expansion of healthcare infrastructure. Indian scientists and manufacturers played a key role in vaccine development. The principles of mass mobilization and community engagement became more crucial than ever. The challenge was immense, but India's resolve was even greater. On January 16, 2021, India embarked on an unprecedented journey by launching the world's largest COVID-19 vaccination drive. This historic initiative was not just a public health campaign. It was a massive logistical operation that spanned the length and breadth of the country, reaching from the crowded cities to the most remote villages. The scale was staggering, with thousands of vaccination centers set up almost overnight, and millions of doses ready to be administered. The campaign began by prioritizing those most at risk: frontline healthcare workers who had bravely battled the pandemic, and the elderly, who were most vulnerable to severe illness. Soon, the drive expanded its reach, opening its doors to all adults and eventually to children over the age of 12. This phased approach ensured that the most vulnerable were protected first, while also building public trust and confidence in the vaccines. At the heart of this monumental effort were Covishield and Covaxin, India's own vaccines, developed and produced domestically. These vaccines became the backbone of the campaign, symbolizing not only scientific achievement, but also national self-reliance. Their rapid development and approval were a testament to the dedication and expertise of Indian scientists and researchers. The achievement was nothing short of extraordinary. By 2025, over 2.2 billion doses had been administered, making it the largest vaccination drive in human history. The numbers tell a story of determination, coordination, and the collective will of a nation to overcome adversity. This monumental success was powered by the tireless efforts of millions of healthcare workers, doctors, nurses, and volunteers. Working at thousands of centers, often in challenging conditions, they ensured that every eligible citizen had access to the vaccine. Their dedication and compassion became the driving force behind the campaign's success. The impact of vaccination was profound. Hospitalizations and deaths due to COVID-19 dropped dramatically, and families across the country could finally breathe a sigh of relief. The vaccines saved countless lives, allowing communities to reunite and life to gradually return to normal. India's commitment extended beyond its borders. Through the Vaccine-Preventable initiative, the country shared millions of doses with nations around the world, strengthening its role as a global health leader and fostering international solidarity during a time of crisis. The drive was a testament to India's resilience, scientific prowess, and unwavering spirit of solidarity. It showcased the power of innovation, the strength of community, and the ability to unite for a common cause. Above all, it echoed the collaborative ethos that first defined National Vaccination Day, reminding the world that when a nation comes together, even the greatest challenges can be overcome. A key to India's vaccination success was the COWIN digital platform. COWIN managed everything from vaccine supply to beneficiary registration, bringing efficiency and transparency. Citizens could easily register, book slots, and receive digital certificates, making vaccination accessible and orderly. The platform tracked vaccine stocks in real time, preventing shortages and wastage. On-site registration ensured inclusivity for those without digital access. COWIN's success is now shaping the future of India's digital health infrastructure. Plans are underway to expand it to track all immunizations, creating unified health records. Born from crisis, COWIN is now a cornerstone of India's vision for a healthier, digitally empowered nation. The pandemic was a catalyst for strengthening India's health security. It underscored the need for self-reliance in vaccine development and manufacturing. India is investing in next-generation vaccine technologies to respond swiftly to future threats. The crisis highlighted the importance of robust public health infrastructure and agile systems. Combating misinformation became essential, emphasizing clear and compassionate communication. Community engagement and health education are now central to building public trust. India's global partnerships, like vaccine-preventable, reinforce the value of international collaboration. The nation is now better prepared to face future health emergencies and contribute to global health security. Building on past successes, India is expanding its universal immunization program. Efforts like Mission Indradhanush are closing immunity gaps left by the pandemic. New vaccines such as HPV for cervical cancer and improved TB vaccines are being introduced. Addressing vaccine hesitancy remains a top priority, with campaigns to build trust and counter misinformation. The goal makes vaccination a widely accepted, essential part of health for all. India aims to be a global leader in vaccine innovation and delivery, supporting other nations as well. Investments in research, manufacturing, and digital health are driving this vision. The future is about building a healthier, more secure India and world. National Vaccination Day has grown from a polio campaign into a symbol of India's resilience and global responsibility. The eradication of polio and the fight against COVID-19 showcased India's capacity for collective action and innovation. The Cowin platform and indigenous vaccines turned crisis into opportunity. Today, the day honors healthcare workers and looks ahead to new vaccines and stronger health systems. India's story is now one of global leadership, partnership, and hope. Initiatives like vaccine-preventable cement its place in the global health ecosystem. National Vaccination Day is a yearly renewal of the promise to protect every life and contribute to a safer world. It's a legacy of resilience, innovation, and hope for generations to come.